Hope you all are doing well. I am posting this video because I want to share my experience with all the women out there who may be interested in thinking about getting their tubes removed. So first of all, I'm Dr. Janet Pollock. I recently gone through the experience of getting my tubes removed. So I kind of want to share this video and talk a little bit about why I chose to get it, the experience from pre-op to the actual surgery and post-surgery. So when I decided to get this done, I wanted to try to do as much research as possible. And with doing my research, I wanted to find out who else got the surgery. So I began to kind of look through some YouTube reviews, YouTube videos that other women have posted to share their story. And so I thought, oh, I want to kind of do that too. I want to post my experience in case there is more women out there looking to have this done and just need a little more encouragement, or just want to find out the experience of other women who have gone through this as well. So I got my tubes removed. Why did I get my tubes removed? I currently have 4 kids. So me and my husband, we have been getting it in. But I have 4 children, and I do not plan to have any more kids. Shop is closed. Done. Okay. And so birth control didn't really work out for me. Taking a pill every day, I would forget. I have a busy lifestyle. I have 4 kids now. Well, 3 at the time. I was trying to keep up with my birth control. And so I didn't want to get the IUD with hearing about horror stories of how the IUD was lunged into their uterus, and I just wanted a more permanent method of birth control, period. And so after having my 4th child, I was super confident about getting this done. I did consider it after my 3rd, but I was scared. I was very scared. I had never had surgery before, never been under the knife, never experienced anesthesia in this way before. And so I was a bit afraid, but after having my 4th kid, I said, no, these tubes have got to go. So that's why I decided. And any woman out there who may be thinking about getting this surgery, just be 100% confident that you do not want more children. I think that is the thing. That is actually the key, because it is permanent. There is no reversal, at least to my knowledge and from the research that I've done. There is no reversal to this process. Okay. You can still get pregnant though. You still have your ovaries. You still have your uterus. It's going to be very difficult though. So you may have to do like IVF, where they take your eggs and, implant it, into the uterus, or, do all of that stuff they do with IVF. That is probably going to be the option if you decide to have more kids after you have the surgery. So just be 100% confident. I know that this is like one of the best decisions I've made for my body ever. All right, so I got my little notes here because I don't want to miss anything. It was a lot. So the surgery that I got was, and forgive me if I'm saying this correctly, I got the Laparoscopic Salpingectomy surgery. If I'm saying that correctly, I'll try to put like a little caption at the bottom. And that is removal of 1 or more fallopian tubes, so eggs cannot travel to meet the sperm to be fertilized. So that's what I got. Tubes are gone. And the benefits of that obviously is no pregnancy. It's like a permanent method of birth control. It also reduces ovarian cancer greatly. It doesn't mess with your hormones, so that's pretty good. And it also used to treat the ectopic pregnancies. So, but the limitations is that if you don't have a good doctor, it can be some damage from the surgery to surrounding areas. So make sure you do your research on finding a really good doctor who has done this several times. And then depending on your body, if you're prone to getting blood clots, then that can happen. And then there could possibly be risk for infection at the incision site. But if you take care of your incision wounds, good, you clean them good, you shouldn't have any problems, okay? And the incisions are really, really small, so you shouldn't have any problems with that if you take care of them. So let's talk about the pre-op experience. So I had to wait 6 weeks after having my 4th child to get this done. And the reason for that is because my doctor said, you have to make sure that your uterus shrinks down back to its normal size. You don't want to be in a whole lot of pain from after having the baby, plus having this surgery on top of it. So it's best to just, wait the 6 weeks and then come back, and then we can get the surgery done. So that's what I had to do. 2 days prior to surgery, I had to take a COVID test. Now, COVID is still alive and thriving in these streets today. So I had to take a COVID test 2 days prior. And that's pretty general for any procedure now. So you take your COVID test, and then the day of surgery, you go in. And also, I wanted to make sure I noted that they told me to wash with this special soap. If you could see that, it's called Hibicleans, if I'm saying it correctly. They wanted me to wash with this soap. It's like an antiseptic soap to make sure that my skin is clean. You couldn't use any lotions, any oils. Your skin has to be completely dry, clean, and free of creams, oils, lotions, that kind of thing. And so I had to wash with this the night before and the morning of surgery. So I had to do that. Of course, they give you your fasting instructions, so you can eat 24 hours before the surgery. So only clear liquids, and then up to 3 hours before surgery, you couldn't have anything by mouth. No water, no juice, nothing, no crackers, nothing. So you have to follow your fasting instructions, and then also have someone drive you there and take you home, okay? Because it's really important that someone takes you home, because you'll be coming up from anesthesia. What else? So the day of the surgery, you check into the hospital. Shout out to Northwest Community Hospital in Arlington Heights. They were phenomenal. That's also where I had my 4th child. They were great. I had a great hospital experience with the birth of my child, as well as the surgery. And my doctor was great too, so I guess that makes a difference too. All right, so they dress you into your gown. They start an IV. The IV, of course, is where they will, of course, keep you hydrated and administer the anesthesia through the IV. You'll see the anesthesiologist. They'll come in and talk to you about the anesthesia, ask all of your medical history to see if you don't have any issues with anesthesia or the anesthesia. And just to know, they ask a bunch of questions. Then, I got to wait for the nurse to come back, and they take you back to the operating room once all of that is done. Now, in the operating room, at least for my experience, when I was given the anesthesia, it's like 1 minute I was up and the next minute I was done. Like, it went by, it seemed like it went by so fast. Like, I can't even tell you what happened after I was rolled into the operating room. I got nothing. So that's how quick the anesthesia for me kicked in. And next thing I know, I was waking up and they were rolling me back to recovery. And surprisingly, I wasn't in a whole lot of pain at all. And I wasn't in a lot of pain even afterwards. And I'll talk about that in a second. But the surgery They do 2 incisions in your abdomen, like one on the left and right, like around where your ovaries are located. So I'll try to post, show a picture of my incisions. But there's 2, one on each side, and then there's one in the belly button. So that's kind of how they go through and get it done. And very minimal cramping after my surgery. I just needed to take, they gave me some Motrin to manage the pain, and that was it. You get about maybe 45 minutes or so in recovery. They give you little crackers and Sprite to put something on your stomach, and you really pretty much got to wait until the anesthesia wears off. Like, I was really drowsy and groggy when I came up from the anesthesia, but after about 45 minutes or an hour, I was straight to leave, get up, walk around. They ask that you pee before you go. They want to make sure that you have a not a bowel movement, but they want to make sure that you urinate before you go, and then you're free to go home the same day. So it was a really quick surgery. It only took about 45 minutes. Well, the actual surgery part took about 45 minutes. We were there for about maybe 2 hours before, and then maybe an hour after. So you do get to go home same day, which is great. What else? Let me see if I'm missing anything. How do I feel now? So it's been 6 days from my surgery, and I feel good. I have not experienced any pain at all, besides the little bit of pain I experienced just coming out of surgery. But I haven't had any pain, and shout out to my doctor, Natasha Harvey. She was phenomenal. She was great. She also delivered my 4th child too, but she was great. I don't have any pain. She is a great doctor who's been practicing for years. She is not only, well, female, obviously, but she is a Black female doctor, which is a huge plus for me, and a lot of minorities. The trust in the healthcare system and the disparities for Black and brown communities are an issue. And so it was really important for me to find someone I trusted, and nothing but love. And I give her 5 stars. Like, she was great. So that's another thing you want to think about too, is who is going to do the surgery. So find a good doctor, someone that you trust. I've heard stories of women experiencing a lot of pain after the surgery, and I don't know why, but I'm glad my doctor was great. Or maybe it's just my body, I don't know, but I didn't have any pain. And you just really, if you do have pain, you'll just manage it with Motrin, or they may give you a little something stronger. What else? So caring for your wounds, the incisions are really small, like I said. So there's not much you really have to do. It's just make sure you keep it clean. Don't expose it to any bacteria. I mean, just keep your clothes off, basically. Like, you don't want your skin or your area rubbing up against anything. I wouldn't recommend wearing any tight pants until you're completely healed, which takes about 2 weeks. But there's some sterile tape over mines, and they just eventually fall off when it's healed. They kind of dissolve or fall off in a way after a while. So yeah, but I am so happy about the decision I made. As I said, I have 4 children. I don't need no more children. So if you are thinking about this, I say do it. But also make sure that you're confident, 100% sure that you do not want more children, because it is permanent. I do want to thank, and I don't have names, but I do want to thank the people who have shared their story, because it really helped me with making this decision too. So shout out to those people who were able to do that for me. I hope this video helps other women as well. I am going to also try to post some updates. It is 6 days after my surgery and I feel great. I don't have any pain. The only thing I will say, there is a slight, like, it's really tender to touch, but it's not pain. So if something rubs up against it, or if I touch it a little bit, there's tenderness, but nothing that I need medication for. So I feel good. I'm happy. Yeah, I feel free. I feel like this is the best decision that I've made with my body. And that's that. So if you have any questions, make sure you comment in the comment section. I'm happy to answer any questions you may have. And I'm going to post another update maybe next week, when I hit 2 weeks post-surgery, to let you know how it's been going, how the incisions look, how I feel. And then I will also try to do an update when I actually have my period, because I'm not sure how that would be. So we shall see. Okay, again, comment below. You can also click on the subscribe to get alerts when those new updates are posted. Bye.